Okay, so hello everyone, and welcome to today's classroom session. Ideally, this is the second technical session, but unfortunately, we were not available last week. So, technically speaking, this is the first classroom session for this cohort. Uh, the actual first technical session will happen at the end because otherwise it will disrupt the flow of the course. Um, all the students who have joined, thank you so much for being on time. We are recording the session, so if anyone misses any part of it, there are no issues. We will be sharing the recording with everyone after today's session. So, this is the second week of the course. In the first week, all of you must have, gone through a couple of modules on, stakeholders of supply chain in general. What is supply chain? Understanding the relevance of supply chain in health systems and how, all that is important towards health system strengthening and the goals of the sustainable development goals. Now, in week two, what we are studying is to understand what are the products which are, distributed throughout health supply chain. And from there, we go how to quantify those products because we need to know how much of the products we need. It's as similar as at our home where we need to know how much of supplies we need on a weekly basis, on a monthly basis, what's our consumption. If we're having any event, we need to increase that. If we are going somewhere, probably then we need to decrease that. So it's exactly like this. But of course, much more complicated because one, there are so many products, and two, especially in health supply chains, um, absence of a product may lead to poor health outcomes, issues in health, and so in certain cases it may also result in death of patients, which is not ideal. So it's a very difficult job, but it needs to be done. So today we are going to discuss some very specific forecast methodologies. The objective of today's session is not to make you experts in forecasting, but to initiate you in this journey of understanding how forecasting works, what is the overall process of quantification, what is its relevance in supply chain, and understand the logic behind the forecasting process. So that is what we are going to cover today. But before we start, I think there is a quick mood check. Let's see how everyone is feeling. So Priyanka, if you can launch the poll, that will be great. I hope
It's
everyone
logged in from another device, so it's inactive.
is it. Okay, let me try to reclaim host and share. Okay. Yeah, okay, I can do that. All right. So the poll is on your screens. Uh, let's do a quick check of how everyone is feeling. Um, all right. A few more responses. Please, everyone, look at your screens. There must be a poll in front of you. And just select how you're feeling today. Okay. All right. So, okay. So it seems most of us are feeling good or either amazing, but there are some students who are feeling just okay. Hopefully, see, there can be two possibilities after today's session. Either you're going to be feeling amazing that you have learned something really great about forecasting, or you're going to be feeling very low because it involves a lot of Excel and a lot of numbers. So it really depends on your appetite towards numbers and Microsoft Excel, which is really a key tool when we're talking about forecasting and even in supply chain. It's a great management tool, and I believe everyone should have at least a basic ability of Microsoft Excel. And today we're going to be using a lot of it. Okay. So let's begin today's session. Like I had said before, today we are going to understand forecast methods using various types of data. And I hope if you have gone through module 4 of the course, it talks about various types of data that you can use to develop your forecast. So we are going to go through some of those data types again. Okay. So during the session, if you have any question, there are specific spots of Q&A where you can ask those questions like directly by unmuting yourself. Or if you really want to just get it out of your system, then just put it on the chat. I constantly monitor chat, so I will look at that question and will either respond at that time if it is possible, or I will respond to it during those Q&A breaks. All right. Hopefully, if you're not speaking, please keep your microphones muted, because it may create disturbance for all other students. Okay. So moving on, so this is from module 4. If you have gone through module 4 already, you may have seen this already. So this talks about the overall quantification process. Okay. So there are 4 steps. So step 1 is to define the methodology, organize a team. So actually first organize a team, then define a methodology for the entire quantification that includes forecasting, supply planning, and then based on that, collect relevant data as well, because all this is dependent on having the right data, in right and accurate data to begin with. So that's the first step. Now, once your methodology is clear, you know what your products are, you have the right data, that's when you first start with forecasting. That is step number 2, which is what we are going to be focusing today. Once you have developed your forecasts, they need to be turned into supply plans. So what is a supply plan? Supply plan is something that you give to your procurement teams. That, okay, these are the products and they are required in XYZ quantity at this particular time. So that is a supply plan. You may also include where they are required. If it is a very detailed national supply plan, or it can be a simple supply plan which says all products are required at the central warehouse first. And then from there, we will decide, which region or which hospital or which primary healthcare center or pharmacy needs what. Okay. But generally that is dependent on each entity's demand pattern. Okay. There is a 4th step as well, which in most places people forget. This is a cornerstone in private sector management as well, because they do it very well. But in the public sector, this is something that we mostly forget. We generally prepare forecasts, we prepare the supply plans, and then the commodities, they start to arrive in the country, they are distributed, they are consumed, and then we start preparing for the next cycle. But what we forget in this entire process is that we also need to monitor our forecast and monitor our supply plans, because forecasts are never accurate. So we need to understand the error rates in our forecast every cycle, so that we can continuously make those corrections every time we do this exercise. So hopefully, when we have done this quite a few times, every year, let's say for 10 years, then we have a very good data set. Then we know that there might be a certain rate of error in our forecast, based on which we can adjust our outcomes and our the way we do forecast and the final supply plans. So it's very important And we will also discuss how to calculate error rates today. Okay, so there is a worksheet on that as well. So, like I said, today we're going to be focusing on step number 2, which is forecasting, which is if I simply define it in layman terms, it means predicting future events by carefully analyzing relevant strategies, data, assumptions, and the overall environment. That is what forecasting means. So that means everyone does forecasting somewhere, either at your home or your office. It doesn't necessarily mean that it is in this process only is linked with supply chain. This happens everywhere. Okay. Even the weather forecasting is also forecasting. So they look at multiple indicators and then they tell us that, okay, what's going to happen tomorrow, next week. So what is the pattern? So they look at the pattern, they collect data and they make the prediction. That is what forecasting is. Okay. So forecasting, it predicts demand based on lots of indicators, which include supply, pricing, and so on and so forth. And it helps us improve our planning, predicting seasonal demand, increasing user satisfaction, in this case user being a patient, reducing safety stock and inventory stockouts. So why do we need to reduce safety stock? Because if we have a very large safety stock, that means that's a large amount of money being held just because we don't really know how our inventory turns are, or what is the demand pattern. And of course, we also don't want stockouts, because if a stockout happens, then that means if a patient comes, they're going to go back empty-handed. It also improves the way the products are shipped, because then if you're doing your forecasting correct, if you're preparing your supply plans correctly, you can get products shipped in bulk, and that is less expensive. And of course, it will result in better pricing. Okay. So that is what basically forecasting means. Again, the same things that I've talked about. But what's important here is to understand is today in private sector and in both public sector, there are multiple tools which are available where you just need to enter the data, add some basic assumptions, and then the tool does everything for you. You don't need to worry about the calculations. You don't need to worry about any logic. You just feed the information in the tool, and then the tool does everything for you. There are multiple tools in the health sector, from WHO, from JSI, from MSH, and also in the private sector from Oracle, from SAP, Anaplan, and there are multiple others. Okay, so we're not trying to recommend any tool here, but what we're trying here is to help you understand the logic that those tools use. Okay, now all these tools, they use the same logic. The same logic can be applied in Microsoft Excel, which is the most basic analytical tool available to us, which almost every one of us know, and almost everyone will have on their laptops or desktops. Okay. Now, using Excel, you can do very basic calculations, or you can do very advanced calculations like time series analysis, regression analysis, so on and so forth. There are various ways you can calculate forecasts using Microsoft Excel. Okay. But today, what we're going to do, we're going to talk about a scenario, and then we will take you from very simple calculations to slightly complicated calculations using some Excel functions, some advanced Excel functions. And that is where we will stop, because this course is not a forecasting or supply planning course, but this is more of a supply chain course. Currently, we are developing a forecasting and supply planning course where all those calculations are done in much more advanced manner with templates and all that. But in this course, we're not doing this. The objective of this course is to just help you understand the basics of it. And what the basics are is to understand the types of data that you can use and how you can use those data in different scenarios. So that is what we're going to look at today. But before we start, there's a quick quiz on the different data sets that can be used to develop forecasts. It's on your screen right now. So it's a quiz. There are 3 correct answers or 3 most relevant answers, and 2 answers are not really relevant in this particular case when we talk about health supply chains. So select the 3 most relevant answers, and then of course we'll talk about what those 3 types of data are in the next slide, using which we can develop forecast. Okay. So, okay, 5, 7, 8, 9, 10. So we have about 16 participants, or 15 rather. Wilson has done this before a lot of times. So Wilson, we're not expecting you to answer. But yeah, about 15 responses are expected. So we have 13, 2 more responses, or another 10 seconds, and then I will stop this. Okay, I think all of you have gone through module 4. So you all are giving the correct answer, and here it is. So you're absolutely right. Most of you have chosen the 3 correct answers, which is services data, surveillance data, and consumption data. Adverse events data and household data, they may be sometimes used in a very specific scenario, but these are not the very usual choices of data using which you would regularly do forecasting. Okay, so they are considered in a very specific scenario when you want to do some reconciliation, you want to check something, that's when you go to these kind of data, but not in general. Okay, so very quickly, let's look at these data sets. Okay, but before, no? Okay, yeah, it's here. But okay, the data sets are part of the scenario. So let's start with the scenario, and then we look at these 3 data sets. So this is a fictional scenario. The map you see, it's a fictional district of a country. It's called District X, very mysterious, or maybe lack of ingenuity from our side. But it has been named District X for a long time now, and we haven't changed it yet. If you have any fancy names that we can put here, by all means. So this is District X. It has a population of about 200,000, with a growth rate of 3.2% annual per year. It has about 5 sub-districts where there are different hospitals and health centers who carry out the health services based on the guidelines by Ministry of Health. Okay, all the products are imported, so they don't have any local manufacturing. Everything is imported into the country, and everything is also imported by District X. So we will keep using District X throughout the scenarios that we look at. We will be looking at 3 different scenarios. And then, there are different products that will appear every time we look at a different scenario. Now, the data sets that we are going to be looking at today, the first is consumption data. Now, when we talk about consumption data, what we actually mean is the product dispensed at a health facility or a hospital. So it is very important to understand at this stage that consumption data actually means product dispensed. It does not mean products issued by a warehouse or a store. Okay, so please be aware there is a difference between issued data and dispensed data. When we talk about consumption, we talk about dispensed data and not issued data. Okay, dispensed data is the actual patient demand. Issued data is not actual patient demand. It is not necessary that if the store of a health center or a store associated with a hospital, if they have issued 100 units of a product to the dispensary or the pharmacy, it is not necessary that in a given period of time, that pharmacy will utilize the 100 units. The patient demand may be less than 100 units which was issued for a particular period of time. So make sure when we talk about consumption data, we're always talking about dispense data. Okay. Second is services data. So services data is the number of patients or consumers who visited and serviced by that health facility or hospital. Okay. Now here, it doesn't matter if the patient received a product or not. It simply means these many patients came and they were serviced by that health facility. Okay. So if we try to equate it with product consumption, then there is an example here, which is related to family planning program, where every time a woman comes to a clinic, they are given oral contraceptive. Okay, but they have to come to that clinic to collect that oral contraceptives, because they're also checked by the nurse or the physician who is stationed at that clinic. Okay, so that's a correlation between services data and consumption data. In most cases, whenever patient comes to a clinic, they are given a product based on whatever their symptoms are, whatever that they're complaining of. But it is not always necessary, but it's a good indicator of comparing the number of patients who came versus the product, the amount of product which was dispensed. Number three, we have morbidity data. In the previous quiz, we called it surveillance data. So both are same. It can be used interchangeably in many places. But the reason why both terms are used, surveillance or morbidity, is because surveillance is the practice. So we do surveillance in a region or in a country, and the data that comes up is morbidity data, which means to understand the magnitude or the impact of a certain disease or illness in a population, in any geography. So for example, if I want to know what is the rate of incidence of malaria in Zimbabwe, so that's the morbidity data that is collected by doing surveillance, continuous surveillance. Okay. If I want to know how many patients are there who are HIV positive, for example, that's also morbidity data. And that data we get by doing active surveillance of patients who are HIV positive in the country. Okay, so it's the same thing, but we use both terms because people, they can use both terms because it more or less means the same thing. So we're going to be using these three sets of data in the exercises. Although there is a very detailed scenario number 3. If you look at the Excel sheets which Priyanka had sent you, there is a very detailed morbidity data linked scenario of malaria. We won't be covering that in today's class, but if you look at the sheet, it's very well explained over there. But we're also going to be using a bit of surveillance data here and there, just to give you an idea that these three data sets are generally used when developing forecasts. So the first exercise, let me just have a quick check on time. Okay, we are okay. So before probably we go into exercise, I will just quickly break for Q&A. If you have any questions so far, please, you can raise your hands, you can unmute yourself, or anyways, you can always write on chat. If no one speaks in the next 10 seconds, then I will move forward. So generally, when people don't ask questions in my class, there are only two possibilities. One is that I'm a fantastic instructor, that whatever I'm saying is that everyone, they're getting it, or I'm a terrible instructor, no one is getting what I'm saying. So I generally try to make the class quite interactive. It's very easy to do it physically, but in the last 2 years, I've been forced to do it virtually because of multiple reasons. But yeah, I've seen a lot of people speak. For example, in the classes that I'm taking for Nigeria currently, they are waiting for me to stop, and there are 10 questions ready. So hopefully by the fourth week of doing this with everyone in Zimbabwe, I would probably see a similar response. Okay, so moving on. So we look at the first exercise, and then I will take you to the Excel sheet. So again, like I said, we're going to be using district X. Now, in this case, we have a product, ciprofloxacin 500 milligram tablets. And I hope if you are a pharmacist, then you would already know what ciprofloxacin is. It is typically used to treat typhoid, diarrhea, infections of lower respiratory tract. It's an antimicrobial, so to say. Okay. This product is available in a secondary pack of 10 by 10. That means there is a blister of 10 tablets, which is packed in a small carton, and 10 blisters are in that small carton. So in total, there are 100 tablets in that small carton, which is the secondary pack. Okay. Generally, when we talk about forecasting, supply planning, bidding, and procurement, we take a unit of measure, which is mostly the secondary pack, which is easier to calculate. The prices are also, in general, quoted in secondary pack units. Okay. So whenever we are doing our forecasting, rather than doing that in number of tablets or capsules or bottles, it's better to do it in the unit of measure, which is mostly the secondary pack. In this case, the secondary pack has 100 tablets. So this is the essential medicines program. There are no new targets. So whatever is going on, the Ministry of Health wants to keep, wants everyone to keep doing the same. And they want us to calculate the forecast for the next 12 months. Okay. The objective here is to calculate forecast using a simple calculation of average monthly consumption. So we are going to be looking at a consumption data. Okay. So let me move on to Excel. Find where that is. Priyanka, I will share the Excel. You can keep sharing the PowerPoint. Okay. All right. So here we are. Okay. I hope it is visible now.
Yes, it is visible.
Okay. Excellent. So this is forecast one, worksheet one of the Excel, which I hope everyone has received. It was shared by Priyanka yesterday. If you have not received it, please look at your emails. It should be there. Okay. So the details that I talked about just now, they are also mentioned here under step one, which is understanding the program and context. So whenever we prepare forecast, the first step is to understand the program and the context. In this case, it's an essential medicines program. The context is that we need to prepare the forecast for 12 months for district X, which has 5 sub-districts, 200,000 population, 3.2% growth rate. There is no new target. It is funded through drug revolving fund, and this is the product. Okay. So similarly, there can be multiple products. So this is just an example with one product, and the same logic applies to hundreds of products as well. The logic is same. Okay. Now, what's written in blue is the data that has been given to us. And what's written in black and everything, that is what I will show how to calculate all these things. Okay. So we have been given a consumption data of 24 months from January 2017 to December 2018. And this is given in number of tablets, as you see here. Okay. So, like I said, the first step is to convert from number of tablets to number of pack, secondary pack. In this case, we know that this product is distributed in a secondary pack with 100 tablets. So what we will do is we will divide the number of tablets by 100. Okay. And that will give us the number of pack. And if we repeat this thing down to the last cell, then we will get the number of packs for each of the months of products dispensed in the last 24 months. And then we can also take a sum of all that. Okay. Now, our objective is to develop this forecast using average monthly consumption. So what is the formula? Let's identify the formula, which is step number 3. Formula is sum of quantities consumed during the past period, which in this case is 24 months, divided by the number of period. So in this case, 24, which is 24 months. So the sum, how do we calculate sum? So we can use the Excel function of sum, and we select the entire column where the number of packs that we have calculated is. We select everything, and the sum comes as 2139. So that's the total number of packs which were consumed in the last 24 months. So the simple calculation of AMC, divide 2139 by 24, and we get 89. Okay, so this is already done, which it has been connected. Okay, so I did it again. So it is 89. Now, when we prepare any forecasting, we tend to identify any assumptions if there are. Okay, if we are not sure of something and the data is not there exactly in that format, then we can take an assumption and document it. So in this case, we will take an assumption of population increase or any unprecedented event. But we will take whatever data that is available to us. And the data available to us is that there is a 3.2% population growth. Now, 3.2% population growth doesn't necessarily mean that 3.2% additional people will require this product. Okay, it doesn't mean that. So that's why we are saying that we will take that indicator as a measure of any additional people who might be requiring this product, using that as a proxy, that population growth indicator. So what we will do is we will add 3.2% to the AMC which we calculated above. So if you see the formula here, P22 is this 89. Okay, so we calculated 89, and then we add plus 3.2% to that 89. Okay, so together it becomes an adjusted average monthly consumption, which is 92. So now we have adjusted the average monthly consumption with an assumption of 3.2% growth rate. Now, in real life scenarios, you can take any type of assumption. Okay, it can be growth rate, it can be seasonality, it can be any target, it can be advocacy efforts, it can be multiple things. But the important thing to note here is that whatever assumption that you take, it must be documented and known by everyone in the team who is involved in preparing forecast. That is the most important thing. Now, coming back. So we get the adjusted average monthly consumption of 92. So now we will use this adjusted AMC to prepare the forecast for the next 12 months. So it is very simple. We multiply 92 with 12. As you see here, P25, which is 92, and multiply this with 12. So we get 1,104 packs. Now, if someone is really curious how much is this in tablets, you can multiply this with 100. So you get these many tablets, or you can also do a round function. Okay. Okay, I'm doing something wrong. Anyways, but if we just round it off like this, so we will get 110,374 tablets, something like that. But we are not using tablets as the basis of our forecasting. We are doing packs. So we need 1,104 packs. Okay. So that's it. It's a very simple yet quite effective calculations in a scenario where it's a pharmacy, it's a health facility, and you know your consumption, and you want to know your kind of, basic idea of how much you may need in the 6 months, in the next 12 months. But there is a rider attached to using average monthly consumption, which is that when you calculate your AMC, like we did here, 89, ideally you should have a long range data. You should not be calculating AMC using 3 months of data, for example. And the reason I'm saying this is because there are a lot of guidelines which are there publicly, by reputable organizations, where they will say that, okay, you have 3 months of data and you just take the average and you get average monthly consumption. The logic is correct, but in the reality, it does not, that average is, it does not consider, if it does not consider a long range, it may be partially wrong. Okay. So whenever you are using average monthly consumption as a, you know, as a calculation for forecast, make sure you have a long range data. At minimum, use 12 months. Okay. Or if you're doing it in days, then at least you do it for 1 month, for 30 days. Then you know your day-wise consumption moving forward. Okay. So with long range data, this works much better. If you have short range data, it might not give you the accurate picture, and then you would need more assumptions. Okay. So that is the only rider attached with it. It's a very simple yet effective tool for doing forecasting at lower levels, at pharmacies, at health facilities. But I don't really recommend doing this at a national level. At national level, you better be using much advanced systems of calculating your forecast, preferably using tools. But if you're doing it in Excel, then at least employ some form of regression analysis if you have a data analyst, who's there, who knows how to do all this. But at a facility level, this is a very good way of developing forecast. So I will quickly stop here while Priyanka goes back to the slides. And if there are any questions, I can come back to the Excel, or otherwise we move forward with the next exercises. I will just quickly stop. Yes, please, Ms. Noman.
Hiya. I just want to ask, so I can understand that the longer range the data, the better. However, when you're obviously, if you've got a population that is increasing rapidly in size, the older data, I don't know if you'd have to adjust it more for population growth, if that makes sense, because it would end up being less accurate than the more recent data. Does that, I don't know if that question makes sense.
No, absolutely. You're absolutely right. And that's why I said, whenever we're developing forecast, we need to come up with logical assumptions. See, data is always historical. You cannot have futuristic data. I mean, we are not that advanced yet. Possibly in future we may be. But data is always historical, and it is always getting old as we move along. That's why we need to employ logical assumption. That's why we need demographic data. We need to know. So see, there are different ways of looking at it, and it may change from product to product. You may also want to know what is the incidence rate of a disease, and how it is progressing in a geography. You may also want to know at a very high level population growth rate, and not at a national level. You may also want to know it at a provincial level, at a state level, at a district level, because those rates vary, and based on that, if you, let's say, have a pharmacy at a particular district, their consumption may be different from a pharmacy which is located 200 miles away from it. because the demographic may have changed. You may also need to consider some other factors like seasonalities, or outbreaks. And of course, the pandemic has taught us those kind of things can come anytime. But of course, you cannot always prepare for a global pandemic, but at least if the product in question is required in some kind of outbreaks, then it is always, it's a suggestion to always have those things in mind, that this product may be required in an outbreak, and there has been a history of outbreak of a certain kind in a certain location. So these are all assumptions. We don't know this for certain. This is not certainty, but it's always a good idea to list down all those assumptions and discuss in a group which are the assumptions which are most likely to happen, and hence may need to be factored in your forecast. I hope that answers your question.
Yeah, no, absolutely. No, and thank you so much. It does make sense. So the more knowledge you have around future events and predicting trends, etc., if you can build those assumptions in, you're only likely to get more and more accurate.
Absolutely. See, like I said, forecasts are never accurate. Even the biggest FMCG companies, their forecast accuracy is rubbish. So it is a very difficult task, and the key here is consistency and repetition. So if you're consistent in collecting the right data, identifying the right assumptions, documenting them, going over them again and again, monitoring them, and then, like I said, over a period of time, you may see that trend that, okay, on these months, we always see a spike. Then you can go and investigate why that spike is happening. Or you may say that, we always see an error rate of 10% up and down. So let's either add or delete based on the way you are seeing it. But that happens in time. It cannot be that, okay, you're starting a program today, there's a new product in the country, and you will have all the data right away. It won't happen like that. So there has to be a trial and error initially. But like you said, the more likely events that you can list down related to a particular product or program, that will help you. Okay. So that's the gist of forecasting and supply planning, essentially. So yeah. Any other questions, any clarifications about the first case, or otherwise we'll move forward? Okay, that's great then. So this I've already talked about. Okay, so one more thing I did not say is average monthly consumption is also it can also be used when you want to calculate months of stock remaining or available at a facility or warehouse, because you know that on a monthly basis this is the amount of stock that is being dispensed. So for example, if every month you dispense 30 units of a product, of which you have 300, okay, so you know that you have about 10 months of stock, unless an emergency comes, an outbreak comes or something. Okay, so average monthly consumption calculations are useful in that case as well. Okay, so we did the Q&A. Now exercise number 2. So in exercise number 2, we are going to be looking at services data for a product which is part of family planning program. Okay, and family planning or reproductive health program is a very typical program where we generally in general we get good services data, and it would be a good idea to use services data in preparing forecasts when we are dealing with family planning program, reproductive health program, because generally those patient histories and registers are managed much better than historically, that what we have seen at least, than any other program. or in that case, in the same breath, for example, vaccines. Generally, those patient histories and patient visits are recorded much better than any essential medicines program or in general, you know. So that's what we have seen in low and middle income countries. Now, in this case, the product is medroxyprogesterone injection acetate 150 milligram, or a lot of you may know it as DMPA. That's the way people call it. I think it's the technical name of the product. Now, this product is the contraceptive, and it's an injectable contraceptive. Okay, so now District X, the Ministry of Health, they want to introduce this product, and they want women who were on oral contraceptive earlier to use this product instead. So it's a product substitution case. So this is a brand new product which is being introduced into the district. And many times you may see a new product is coming into your system for which you have no data whatsoever. So that's where you want to use this kind of a scenario. Okay. So this product comes in pre-filled syringes with one secondary pack having 24 injections. So the secondary pack has 24 units. One injection is needed every 3 months, and I will talk about it slightly in the next slide, a bit more about CYP, couple year of protection, which is important in this case, again, for family planning. The target, there's a target. In the previous case, there was no target. The way it was, it has to be used like that. But in this case, there is a target. The Ministry of Health wants in District X that up to 60% of women should be transitioned to this new product of medroxyprogesterone acetate. Okay. The reason being, since it is more effective, it's a more effective product, and it's easier to administrate as well. The Ministry of Health also wants District X to organize advocacy programs in the district for women to adopt this new product. Okay. So these things we will use when we take our assumptions. Okay. The product is funded jointly by Ministry of Health and UNFPA, United Nations Population Fund. Okay. The forecast period is again 12 months. Our objective is to forecast the product using services data. So we will have services data already, and then using that, we will prepare our forecasting. Okay. But before we go to Excel, let's discuss what is CYP factor. So couple year of protection is a metric or an indicator, whichever way you want to call it, which estimates the protection from pregnancy provided by contraceptive methods during a 1 year period. And it applies to both. It applies to both sexes, male and female, as a couple. Okay. So how are CYP calculated? So there has been extensive research done on every contraceptive method, and based on that, scientists have given this CYP factor to each and every contraceptive method. WHO and UNFPA, they have done a lot of work about this. So there are lots of publications that you will find on how and why for contraceptive pills, the CYP factor is 15, and for condoms, it's 120, for example. Okay. But the basic logic is that 15 pill cycles are needed in a year to prevent a pregnancy. Similarly, 120 condoms are needed in a year, male or female equivalent, to prevent a pregnancy. So if we take that logic, what would be the CYP factor of medroxyprogesterone acetate injection? Any guesses? You can type in the chat, or you can also speak. What would be the CYP factor for medroxyprogesterone acetate? No one? It's a very simple calculation. Let me go back to the previous slide. So we said this injection is needed every 3 months So just how many will be needed in 1 year to prevent a pregnancy? All right. Yes. Okay. Now everyone is writing. So yes, you're right. 4. The CYP factor for medroxyprogesterone acetate is 4 because we need 4 injections in a year to prevent the pregnancy. Okay, so keep this in mind. We will be using this metric in the exercise that we do. Okay, now I'm going to the Excel. Okay, so this is scenario number 2, forecast using services data and scenario planning. So we're also doing scenario planning here because this is a new product. Okay, so we don't have any historical data for this product. So there is no consumption data. There is no service data for this product as well. So what are we going to do? So again, but before that, we have this information which is same of what I showed on the slide, but we have one more set of data here. We know the number of women between the age of 15 and 49. We call this as reproductive age women. So only they are going to need this injection. Okay, so that's why we are only concerned about this number rather than all other women in the district. Okay, so there are 60,000 women who are at the reproductive age between 15 and 49. Okay, now, so the scenario that we're going to plan is that this is a product substitution. So we are going to be looking at, first of all, how many women in district X are on oral contraceptive. Okay, from there, we will create an algorithm to figure out how much of product would be needed to move at least 60% of women to this injectable contraceptive. So that's a scenario that we're creating. But first, see how many women, unique women, came to the clinic in district X to get oral contraceptive. And this is a unique number. So it may be more every month because women will come every month. But this is a unique number of women. The data has been collected from all the facilities and duplications have been removed. Okay, so every month new women may have registered, and that's how it keeps on going up and down. But overall, in the year, 25,116 women, unique women, in district X, they came to the clinics and got access to oral contraceptive. So that is our services data. Now we need to prepare a forecasting algorithm. So this is the algorithm highlighted in yellow. 3.1, number of women who visited the facilities. Then we need to understand the program targets and assumptions. And then we will reduce the amount of product based on those targets and assumptions. Okay, so let's go down and see how this works. So on the right, if you see, I have mentioned step number 3.1 from here, 3.1, 3.2, 3.3. So all this is coming from here, the algorithm that we have created, 3.1, 3.2, 3.3. Now, first of all, the total number of reproductive age women in the district is 60,000. This is what we know of. So we will write this because this is an important figure. We also know the total number of women who visited the facilities in the previous year to access oral contraceptives. That is 25,116. This is the simple sum of all this data. Okay, so it's a sum function of Excel. If you see here, it's a sum function. Okay, so we know that as well, 25,160. Now, using this number, we know the target for us that has been given by the Ministry of Health is that up to 60% of women who are on oral contraceptive must be transitioned to the new product. So if 60% of women needs to be transitioned, we can just take 60% of 25,000. That becomes 15,070. So this is the formula here. It's been rounded up Okay, 60% into J34. J34 is highlighted here, 25,160. So that gives us 15,070 women who would have to be, and that's a target, who would have to be transitioned to this injectable. Okay. Now, we also know that there is going to be new advocacy being done in the district towards this product. And we take an assumption that based on the advocacy effort, maybe about 10% of new users. Now, this is not part of this pool of 25,000. This is coming from the pool of 60,000. Okay. So 10% of new users may also come because we will do advocacy. So that's an assumption. Okay. We don't know for sure. It may be 5, it may be 8, it may be 15. Okay. But we have taken an assumption based on discussions and everything, based on looking at other programs in the past. Okay, how much does advocacy effort result into? So we say, okay, about 10%. So in total, for the first year, for the next year, when we are introducing this product, we assume that a total of 21,070 women will need this product. Okay, for 1 year. So this is for 1 year. And we know for 1 year, the number of injections that are needed per woman is 4, which is the CYP factor, which we've all calculated. So we know the number of women who will need the product. We also know there are 4 injections needed per woman. So it's a simple calculation. We multiply 21,070 with 4, and we get to 84,280. Okay. 84,280 is the number of injections required. But like I said initially, we always calculate in number of packs. So we divide this number by 24. You see here, 24, which is the pack size, which was also mentioned initially, 24 into 1 pre-filled syringes. So we will need 3,512 packs of medroxyprogesterone acetate the next year when the product is introduced in District X. So this is an example of how, without having consumption data, we can prepare a forecast algorithm, which is nothing but scenario planning, and use another set of data, like a services data, to calculate our product demand for the next period. Okay. In this case, we only took one assumption, but there can be multiple assumptions as well. Any idea what other assumption can we add here? Anyone? Okay, just think about it. Okay, Lou, you want to say something?
Would you ever, I don't know if you do it at this stage, or whether you do it later stage, adjust for things like expiry time of the new product?
Not at this stage. So that is where when we start doing supply planning.
Okay.
So at forecast level, we're looking at absolute number of products. Now from this 3,512, then we
Okay.
start adding more or reducing based on because let's say this is a new product in which way. So let's say we don't know what will be the expiry in this country or in this district, but we have some data from another district. So we can take some proxy data that, okay, 3% of product will be expired or damaged or stolen or whatever, then we need to add more. Then we may also need to account for wastage, which is also part of expiry. Expiry is part of wastage. So in total, we can look at a wastage rate, and then we can add into it. There can be other things when we look at supply planning for established programs, like we look at stock on hand, we look at stock in pipeline. We also look at safety or buffer stock issues, and then we adjust the final number based on the initial forecast that we have come up with. But that's the supply planning step. So when you go to module 4 and you look at the supply planning lesson, that's where we explain how, once the forecast is when we arrive at a forecast, that forecast has to be adjusted with the supply data. And then the final supply plan, comes to be, which is then sent to your procurement team or purchasing team for finally, bidding or contracting with the manufacturers to supply that product. Okay, but not at this stage.
Okay, thank you.
No problem. Any other clarification, any question or any assumption that you think that can be added in this particular scenario? I'm all ears. Priyanka, maybe we can take this back to the slide deck very quickly. Excellent. Okay, so I discussed. Yes, someone wants to speak. Please go ahead.
Hello, yeah. So I just had a question, right?
Yeah.
Concerning that assumption of the 10%. So confirm in our assumption, we're just assuming that every woman, is gonna
Yes.
use the injection right the whole year. But do we take
Yes.
into account maybe those women who leave the injection because maybe they're having like adverse effects, and then they realize that maybe it's not the best form of contraception for them, and then they leave it out? Is that like
Yeah.
catered for within this assumption, or it's like
Yeah,
a completely
absolutely.
different
Absolutely,
thing?
you're absolutely correct. There can be this assumption made as well that some women may experience adverse effects from this product, and they may want to move back to oral contraceptive or any other means of contraceptive from the contraceptive pool, which is there, which is more accepted in that district. You may not have that data right away, so it will become an assumption.
Okay.
So you may have to look at
All right.
this data from other geographies, from other districts in the same country, or some other country,
Okay.
that what is the percentage of women who complain of adverse effects of this product, and move back to the regimen or the contraceptive choice that that they were using before this injection. And then you can add
All right.
that to the equation. That would mean subtracting the demand, product demand. So
All
let's say you
right.
say 1.5% of women may complain and move back. So then
All
from
right.
that 3,512, we reduce 1.5% of women, or
Okay.
at least, or maybe we do it much initially when we were calculating the number of women. So from the total 21,000, we reduce 1.5%, and then we do our calculation. And you're absolutely right. This is a very good assumption, by the way.
All right. Thank you. All right.
Yeah. Excellent. So like I said at the beginning of this scenario, that we don't have any consumption data. So this is a new product. Now, once let's say an year is passed, then we will also have consumption data. So then for the next year, when we develop forecast, then one forecast can be developed using services data, because then you will know how many women came to the facility for this particular product. Okay, or in general for contraception. Okay, from there we can make different analysis, and then you will also have the data, consumption data for this product, which you can compare with the services data as well. Okay, there's another issue with this exercise where there was no supply data as well. Okay, so there was no consumption data, nor there was any supply data. So we were forced to use services data. Okay, so there may be several cases whenever you are launching a new product where you will not have these data, which generally you use for forecasting. So in those cases, you may have to resort to services data, surveillance data, and come up with your forecasts. Okay. In the Excel sheet, scenario 3, forecast 3 is another such example of preparing forecast without using consumption data. But that scenario is quite long. It takes a lot of time to explain, but in the sheet, it is explained well enough for you to understand. But when you go through it, if you don't understand anything, there is a WhatsApp group which has been created. Please post your queries there. You can also click a picture of that Excel sheet and just highlight the area which you don't understand. Just put it on the group and I will get back to you with whatever clarifications you have. Okay, we have tried covering all these scenarios in previous classes, but we have seen it always goes way above time. So now we have stopped covering that scenario in the class, but we always provide that scenario with to everyone so that you also see how we can use morbidity data, surveillance data, demographic data in coming up with a forecast. And that scenario is with malaria medicine, anti-malarial medicine. Okay. So now we will quickly move on to scenario number 4. Now, scenario number 4 is the same scenario, but our objective will change. So it is still back to scenario 1, where we had ciprofloxacin tablet. It's the same exact context, 100 tablets in a secondary pack, same indication, same program, no new targets. It's again Ministry of Health, Drug Revolving Fund, forecast period of 12 months. The data is again consumption data of 24 months. Sorry. But now we're not using average monthly consumption. We are going to be using an Excel function called trend. So this Excel function is used to create trend, is used to understand trend analysis, forecasting. So we'll use that function to calculate our product demand. Okay. So let me go back to Excel. Okay, so this is forecast 4. Very quickly, this is forecast 3. So if you follow stepwise, you will understand what we are trying to say, and then you can figure out, how to arrive at product demands. Okay. Now, so forecast 4. So we have this data, which we saw on the slide. Okay. Then we have the same data of consumption of tablets for 24 months from January 2017 to December 2018. And we have converted them into secondary packs. Okay. Now, before I explain the trend function and how it is used in Excel, let me give you a conceptual idea of what is a trend line and how we use it. Okay. So I'm going to show you this graph, which is now at the center of my screen. So if you see this orange line, which is going up and down, this is the actual consumption reported month by month from January 2017 to December 2018. That's the actual consumption, up and down, up and down. So Excel has this function of creating a trend line. So the trend line suggests or tells us in general how that consumption pattern is moving. Is it a constant, steady trend line, just there is no change? Is it a rising trend line going up, or it is a declining trend line going down? So that is what we generally try to figure out when we plot a trend line on a graph. Now, if you carefully look at this trend line, this is very slightly going up. So it starts at around mid 80s, and then it ends here, at about something about 90s, okay, or late 90s, for example. The value is actually 95. Okay, so this is the trend line slightly going up. Now, at this point of the trend line, when it starts from January 2017 and ends at 18, this part of trend line, the data we have, this is based on this data, which you see in orange. But post December 2018, from January 19 to December 19, the actual data is not there. What we have done is we have extrapolated the existing trend line. So this extrapolation from this point, from where my cursor is, January 2019 to December 2019, is our forecast. This extrapolation. Now we can also add assumptions on this extrapolations, but first we need to understand how to arrive at this extrapolation. Okay, so now I will explain the trend function. here on this column. Okay. So if I type trend on Excel very quickly, tell me more. Yeah. So sorry, it's loading. So let it come on screen. Why it is not coming? Yeah. So if I search for trend on Excel, it gives this help where it tells us how to use the trend function. So the trend function, for using trend function, we need to know three things. And again, it is very easy to explain it using the graph. So if you see the x-axis here, this is the time. On the x-axis, we have time. On the y-axis, we have the consumption. Okay. So we need x, known x. We know the x from month 1 to month 24. That is our known x. If you see here, known x is this here. And then we need to know the y's. That is the known y's. In this case, it's the consumption. And then based on this, we will calculate new x. Sorry, based on this, we also need to know the new x, the forecast period, and based on known x, known y, and new x, we will calculate new y, which is the trend line, the extrapolation. That is the new y. Okay, because that is the unknown quantity here. Okay, so now let's see how the function looks like. But before I talk about that, let me delete all this. Whenever we are using trend function, the idea is not to just use one cell. Okay, so we don't want to calculate in just one cell. We want to select the entire range of those 24 months where we want to plot the trend line. Because in that way, Excel will populate the entire 24 months at once. So we select the entire 24 months, the cells, then we write trend known y's. In this case, is the dispensed packs. We select the known y's. Then we know, then known x's. This is the period. So from 1 to 24. So I've also created a column in numbers just to make it much simpler rather than the words of January 17 to December 19. So it's much simpler to use this in the function known x's. And now first in the 24 months, we just want to plot this trend line because there is no new x. We already have the data for those 24 months. So we're just going to plot the trend line of existing data. To do that, we are not going to close the bracket and press enter, but rather we are going to do Control, Shift, and enter. Control, Shift, and enter. So as we do that, the entire thing automatically gets plotted. And if you see this line gets plotted again. As soon as I deleted that, the line goes away. Okay, because this graph is linked. So now we have the trend line. Okay, so it goes from 86 to 92. Like I said, it slowly is increasing. Okay, so now we have a trend line for 24 months. Now we are going to use this trend line extrapolated for the next 12 months. This area. I've deleted this once again. And if you see on the graph, it's gone. Okay, now we will plot it again, and then the graph will be appear. Okay, so we select this entire area. Again, trend, known y's, again the same 24 months, known y's, known x's. Now we need to also add the third thing, new x, which is months 25th to 36. This is the new x. Now we need to figure out what comes, which is the y for us, the trend line. So to do that, we need to press Control, Shift, and enter. The trend line gets populated 92 to 95. And if you see on the graph, it gets populated again. The extrapolation has appeared. To calculate number of packs needed for this period, we can take a sum of this highlighted area, and that gives us 1122. Okay, so this is the calculation based on trend line, based on trend. So if you remember, when we did with AMC, it came to, after adjustment of population, it came to 1104. In this scenario, using trend line, even without adding any assumption, it already is giving us 1122, and then you can add any assumption on top. You can add population, you can add any other disease based assumption, anything else you can again add on top of this. But this is the basic gist of using the trend function. Okay, again, for using trend function, I would again recommend having a long range data, because it won't really work if you just have like 3 months of data. It's very easy to visually see and create a trend line on a 3 month data, and that doesn't really work. So have a long range data and then try to use this function. There are other functions on Excel that you can use. This was the simplest that we could find for teaching purposes. There is a very detailed forecast function with seasonality and so on and so forth. And then, of course, like I said, you can do regression analysis on Excel. You can do time series analysis. You can do moving averages, which is part of time series analysis anyways. So you can do all those, all those things on Excel. But this was the simplest way that we could show you how Excel can be used to come up with forecast. Okay, I know for some of you who are not very well versed with Microsoft Excel, this may look very difficult, but trust me, it is the simplest that we can find. And also, when we share with you the recording, try to go over this a few times, because there is an exercise at the end of module 4 where all of you will have to do the same. So make sure you fully understand this, because the exercise will ask you to do all this with a new example. Okay. So if you have any question, please, you can ask me. I can revisit it, certain areas if you want. But yeah, please make sure that you understand this trend analysis in a proper way, because there is an assignment on this. Okay. So let me quickly check if you have any follow-up slides now. So if you have any questions, please, on trend or on AMC or on services, you can ask. After this, we will go to forecast accuracy. So I'll just take a quick break, and any questions are welcome. Okay, let me move forward with a quick poll. And if you find any questions to ask, you can still ask. So this is a poll to understand what kind of data set that you use in your country or in your organization, just to understand from your perspective. So it's now on your screen. Please go through the poll. That will also give us a good idea of how in your country or in your organization you are tackling forecasting, what kind of data that you are using. So we have about 15 participants currently. So I expect 15 responses. Okay, yeah, a couple more, and then we are good to go. Okay, maybe not everyone they want to respond. So we have about 12. Please, if you see the poll, please respond. If you have any questions, you can also ask in the meantime. Okay, all right. So that's about it then. So majority of you are saying there's a combination of consumption and services. So surveillance and scenario building, either you haven't seen or maybe it's not being used. I mean, if I find any time after the forecast accuracy, then I can quickly do the malaria example to show how surveillance data can be used. But I think first we need to do the forecast accuracy because it's quite important. All right. So moving on then, are forecasts ever correct? The simple answer is no. They're not correct. There's always a degree of error. And the important thing here is to understand that degree of error. Okay. So that you can factor that error into the next time when you are doing your forecast. Okay. But of course, it will take a few practices, a few iterations before you are pretty sure of your standard average error rates. Okay. There is also an example on the screen where slightly extreme example where when everyone forecasted their needs of medical gloves by the end of 2019 for 2020 or 2021, no one knew that there's a pandemic coming and the demand of medical gloves will shoot up by probably by 1000x or even more, I guess. So this is just to say that no one knows what's going to happen in the future. But I think what Ms. Nomand asked initially, and we discussed that we need to find as many likely events that may happen in the future. Put those in our assumptions for forecast. But at the same time, we need to continuously monitor our forecasts against the actual consumption. The reason why it is a bit difficult to do is because forecasts are developed by a different team, generally a supply chain team or people sitting at the central level in the capital, whereas the actual consumption is happening at a facility level, which is down to your provinces and districts, small towns. And it takes a long time for that data to come up to the central level. It might be a bit easier to do in the private sector where the same company, there is a good data governance system in place. But in public sector, this is something which is slightly missing. And hence it becomes very difficult to continuously monitor forecasts against actual consumption. But having said that, even if you can't do continuous monitoring, at least you can do once in 6 months, once in a year. But the matter of fact is it has to be done. I mean, if you're not doing it, then you are setting yourself for failure eventually. So it is very important. Now the question is, how do we understand the accuracy of forecast? How do we ensure forecasts are accurate? So we do the error analysis. We understand what kind of errors are there in our forecast. Now, the three metrics on your screen: mean absolute deviation, mean squared error, and mean absolute percentage deviation. These are industry standard terms being used everywhere. And this is how you calculate your forecast error. There is no other way. Okay. This is the only way. Okay. So starting with the simplest one, which is the mean of absolute deviation, which simply means that, okay, if your forecast for month 1 was 60 and your actual consumption was 80, which means you're off by 20 units. Okay. Similarly, if your consumption was 40, even then you were off by 20 units. That's the absolute deviation. Now, the fact here is that in one case you forecasted less while in the other case, you forecasted more. So either it was plus 20 or it was minus 20. But when we talk about absolute deviation, absolute means we don't talk about minus or plus. Okay, we're talking about the absolute number, which tells us how much our forecast was off. Doesn't matter which way, plus or minus. Okay. So then if we take the mean of a range, let's say 12 months, then we can say that a mean absolute deviation was 50 units or 60 units or whatever. Okay, so that will come in units. The unit being the pack size, number of packs. Okay, so that deviation will come in the pack size. Then, why do we need mean squared error? The reason why we need mean squared error is because, like I said, if you are not using absolute deviation, in those cases, one, it is very helpful. Number two, mean squared error also shows you those places where your error rate is very high, and it just amplifies it. Okay, it is very simple. When we identify the absolute deviation, we just square it out. Okay, so if it is 4, then squared error will be 16. If it is 9, the squared error is 81. It's the square of that particular number. Okay, and we will all see this in Excel. So mean squared error is helpful when to show where the error rate was high, very high, and then we can find the cause of it, why in that particular month the error rate was very high. Okay. Finally, we have mean absolute percentage deviation, which is I think the most used metric when talking about forecast, knowingly or unknowingly as well. You may say, okay, we were 4% off, without knowing that we're talking about mean absolute percentage deviation. Okay. When we talk in percentage terms, it is much simpler to understand. Okay. And it's also a great metric to know that whether, we were 4% less or 4% more, but of course, we need to specify that. Like in the example, it says we were off by less than 4%. We can also say 4% in which direction, rather than saying we were off by 3,000 tablets. But if we say 3,000 tablets, we don't know 3,000 tablets out of what. We don't really know. Okay, 4% makes it much more easier to understand. Okay, 4%, which is not that high. So how do we calculate all this? Okay, so let's go back to the Excel very quickly, and let me show you some basic calculations. And then if we have some time, then we can also go over the malaria example. So the way we have organized this is that this forecast 1 AMC is coming from sheet 1. Okay, this sheet, forecast 1. Forecast 4 trend is coming from sheet 4. Okay. And this actual consumption is a hypothetical data that we have plotted against our forecast. So this is a hypothetical data, although all this we have taken from some real example, but we have changed some things here and there to make it more teachable. Okay. So forecast 1 AMC, we just used the AMC for each month. Our AMC was 92, adjusted AMC. So now we have used it for each month. For the trend, we knew the data. Let me put it in. Yeah. So we knew the data which came here, month-wise data. We had that. We just copied and pasted it here. It's the same data. If you see the total here, 1104, 1122. It's the same data that we got in forecast 1 and forecast 4. So now we will see which forecast is more accurate. Okay. Now again, this is all hypothetical scenario. We just want you to know the calculations of MAD, MSE, and MAPE, which we saw on the slide. So now look here on this side, this entire place. So MAD, mean absolute deviation, MSE, mean squared error, MAPE, mean absolute percentage error. So we start with the AMC forecast. Okay. So to calculate MAD, first of all, we need to calculate the absolute deviation for each month. To do that, we use the function absolute so that the outcome does not come in any positive or negative value. It always should come in a positive absolute value. We subtract the forecast from the actual consumption. So 88 minus 92, although it should say -4, but since we have used the absolute function, it will always come in a positive value. So 4. So same doing that for the entire 12 months. Okay, so every time F13 minus B13. Okay, F14 minus B14. So for every month we get the data and then we do an average. Okay, so if we take the average of this entire thing, we get the mean absolute deviation. Okay. Similarly, now with mean squared error, doing a cube of it, we're doing a square of it. So if you see here, this is the biggest error here. Let me quickly. Am I audible, Priyanka? It is saying I have a slight.
Yes, you're audible. I mean, for a minute, it was like for some seconds, it was off. Now it's fine.
Okay. So once we calculate MAD, now let's go to MAC. So simply we do the square. Now if you see here, 13 in this sequence doesn't look too big. But when we square it up, this 169 looks very big. So it tells us that this is a very big error in the forecast. Then we take an average of all this. So we get mean squared error of the entire series of the 12 months. So for this entire forecast, this is the mean squared error. Now, how do we get the percentage? It's very simple. We divide the absolute deviation by the actual consumption. So divide the absolute deviation, which we calculated here, by the actual consumption. So I12 divided by F12. So now we will keep getting percentages. And if we take an average of the percentage, we get mean absolute percentage error, 6.19% in this case. We follow the same technique for the trend, the forecast developed using trend. We get the mean absolute deviation, we get mean squared error, and then we get the mean absolute percentage error. Now in this case, the error of forecast developed with trend is slightly less than the error of forecast developed with AMC. Now it doesn't mean that AMC is a bad way to do it. It's just a fictional case to show that, okay, in this case, this data is slightly better than the other data. In other cases, it may be entirely opposite. Okay, we don't know because it really depends on this actual consumption. Okay, so this calculation will never change. So you can just take it to your heart. This calculation will never change. What will change is your data, your forecast, your actual consumption. The calculating absolute deviation, squared error, and percentage error, the techniques are same everywhere you go. Okay, but no matter what your data is, but this technique will remain the same. Okay, so you can use this technique with your actual data, plot your forecast on one side, plot your actual consumption on the other side, and just do this analysis. You will see what is your forecast error. Okay, now if you want to say, okay, how accurate my forecast is, then it is very simple. You minus this by 100, so you get 99. Okay, I don't know, something is wrong. 5.55. Okay. Yeah. So your forecast is 94.45% accurate in this case. Okay, which is which is a pipe dream, I would say. Generally doesn't happen. Okay, forecasts are generally accurate to the tune of 40, at the most 40%, more or less. There are very few places where forecasts are highly accurate, or that too for a whole year. I mean, for a month, it may be this much accurate, but for a whole year or 2 years, generally forecasts are not this accurate. Okay. For a very longer term program, eventually it may get to 70-75%, but in the first attempt, maybe not. Okay. So that's forecast accuracy for you, how to calculate errors and understand how accurate your forecast is. If you have any questions, clarifications, thoughts, comments, please don't hesitate to speak out. We have some time. I can break for about 5 minutes, and then I can quickly go over forecast number 3. But it will be very quick, because you can just go through it by yourself. Yes, please.
Hi there. One thing that I found quite useful when looking at deviations and trends in my previous line of work was to look at the conditional formatting. So you can add a color scale to show the difference. And that, I think, I've just done it to this data set to look at the MAD versus the MSE, and it shows quite nicely in colors what that does.
Yeah, so it's a great technique, Lou, and I'm very fond of it. The only reason we don't do it here is, in our classes, generally for our audience, the level of proficiency in Excel, it varies. So we try to keep it at a level where almost everyone can understand. Conditional formatting is something that a lot of people don't know, and there are multiple ways you can do conditional formatting. You can brilliantly create some sort of dashboards with green, red, blue, or traffic light colors, for example, green, yellow, red, so that it shows you places where accuracy is bare minimum, while the red will show you places where your accuracy is very high. So it's a great technique, and I'm very happy that you're already using those. But for anyone who doesn't know what conditional formatting is, please, you can read about it, and you can utilize them in your forecast. You can utilize them in your dashboards, just to have a quick glance with colors whenever you are working with numbers, and you can define your criteria when you are using conditional formatting. So great point, Lou. Thanks a lot. And for anyone else who wants to know what conditional formatting is, please don't hesitate to go on Google, search for it. This is the tab of conditional formatting, just so you know, which is right here. So if you see these color scales, I think this is what Lou is talking about. So you can create different types of color scales, and you can create your own color scales as well. You can have a new rule, so on and so forth. Okay, so let's not delve too much into it. Any other comments, clarification, question? Otherwise, I'll quickly show you forecast 3. Okay, make sure you go through the recording a few times, because we have seen historically this is the toughest session that people have found because of the usage of Excel. But still, I would say this is very simple. All the functions are already there on your sheet. You can just write them down on your Word or a notebook. Try to remember them, and use similar or use the functions when you do some similar scenarios in your actual work. Okay, so very quickly in forecast 3, this is based on surveillance morbidity data. The reason I'm quickly going through it is because all of you said you are using morbidity data in your actual line of work. So let's go through it very quickly. One example. So the steps are similar. First, we understand the program context. This is step 1. Step 2, we need to identify and calculate demographic and morbidity data, which we have. And then step 3, based on that, we prepare the forecast. Okay. So now let's see what is the program context. So it's a malaria program. The product is artemether-lumefantrine, artemether 20 milligram, lumefantrine 120 milligram. This is a combinational product. Okay. Now the regimen is slightly complex here. It's not a very simple regimen. This regimen is based on age or weight. Okay. So if it is a newborn and a child up to the age of 3, then they need 2 tablets every day for 3 days. So it's only a 3-day regimen. Okay. For anyone, it's a 3-day regimen. It just the number of tablets will change depending on age and weight. So the first is 2 tablets per day, then it goes to 4 tablets per day, 6 tablets per day, and 8 tablets per day. So in total, in this case, we need 6. In this case, we need 12, 18, and then 24. The reason why this is important is because manufacturers provide this product in different packs. So for different age, either they have a 30x6 secondary pack, meaning 180 tablets in a pack. So a blister of 6 and 30 blisters in one pack. Then a blister of 24 and 30 blisters in one pack, meaning 720 tablets. So it varies depending on age group. So our forecast also have to be as per this categorization of age groups. Okay. Now, this program is malaria program. Again, it's a treatment substitution. So people who are using chloroquine or any other monotherapy for that matter, they have to be put into this combinational therapy. Okay. So that's why we don't have consumption data. We also don't have any services data. So that's why we need to have demographics and morbidity data to calculate product demand in this case. It's funded by the Global Fund. We need to prepare a forecast of 12 months. And then we also have some more data, demographic data, that the number of children between the age of up to 3 years is 18,000, 3 to 8 years, 25,000, and 8 to 12 years, 6,700. So we already have this data provided to us for District X. Then this is the surveillance data. Okay. Surveillance data says that in District X, the annual malaria incidence is about 18%, which is subcategorized into for children up to 12 years of age, about 7%, and for adults at about 11%. Okay, so which this 18% is not really helpful. Actually, what helpful is this 7% and 11%. Okay, so we will use these 2 percentages. Okay, now we assume that this 7% is same across the gradient of age up to 12 years. So it's 7% for 0 to 3 years. It is again 7% for 3 to 8 years and 7% for 8 to 12 years. It's the same incidence rate for all the 3 stages for a child. Okay. And for adults, it's 11%. Adults mean above 12 years old. Okay. Now, so we need to calculate number of patients, prospective number of patients based on this data. So we know that there are 200,000 people in District X. So we subtract these numbers, 18,000, 25,000, and 6,700 from this number of 200,000. We get 150,300. Okay, so we get number of adults in District X 12 years or more. Okay, then these 3 data sets we have 18,000, 25, 6,700. Now let's use the incidence rates. So for adults, 11% of this number, 150,000, we get 16,533. For children, 3 ranges, 7%, 7%, 7%, based on this data, 18,000, 25,000, 6,700. Then we know that there is a 3.2% growth rate. So for the next year, we also know that there will be, let's do it like this. We know there will be 3.2% into, we know there will be 6,400 new births. So we have to take 7% of this as well. Okay. So 7% of new births, because we know that the incidence in children from 0 to 3 years is 7%. So that means 448 additional prospective patients. So in total, if we take a sum of all these numbers, these here in bold, let's say, we go to 20,460. But again, this 20,460 is not very important. What is important are these numbers. So 448 has to be added to this number, 1,260. So ideally, we should be doing this. So for adults, the prospective number of patients are 16,533. Children 0 to 3 years, 1,708 for the next year. Children 3 to 8, this number, 8 to 12, this number. Now we come to this table here. Again, it's like a treatment algorithm that we have created in services data example is the same. Total number of prospective patients, number of tablets per regimen, total number of tablets required, divided by the pack size. So 16,533 multiplied by 24, because adults need 8 tablets per day for 3 days. Okay, so we get 396,792 tablets divided by 720, we get 552 packs. Similarly, for all the others. Okay, number of prospective patients, number of tablets in the regimen, and then divided by the pack size. So this way, now we know we need 500 packs of adult, then 57, 59, and 16. Because because of the regimen, we had to divide this like with age categories. It cannot be that we take a sum of all these because the pack sizes are different. So we need to instruct the suppliers that we need secondary packs of this specification up to this number because of these calculations. Okay, so this is one example where we calculated product demand without any consumption data, without any services data, just by using surveillance data or morbidity data and demographic data, the amount of number of people who are there in any geography. Okay, so that's a basic example. There are other very complicated examples which are there. You can find on web. If you want more, then we can also send you. There are many examples of services data from the Reproductive Health Supplies Coalition, which is they work with UNFPA and other partners in guiding for forecast, and they have lots of examples in couple of guidebooks. So if you have any questions here, you can ask. If you have any questions about today's session, you can ask. We can go back to the slide. And anything about anything up to the point that you have gone through on the platform. So all questions are welcome. I will launch a quick poll about feedback. In the meantime, if you have any questions, if you have any clarifications, comments, you can ask me. After this, we will end the session. We're almost in time since there were not many questions. But yeah, I heavily recommend you go through the recording when it is available a few times if you are not very good with Excel, so that you can fully understand how to use these techniques. Okay. Okay, I hope in the next few sessions there will be more questions. The next session that we have is on procurement strategy or strategic procurement, whichever way you call it, and there will be a group discussion. So be prepared to discuss amongst yourself. Be prepared to work on a document because that document will have to be then uploaded as part of your assignment. And I hope everyone, you should also inform your peers to be present during next session because the group discussion is very, very interesting and very specific. Although it was a fictional thing that we have created, but it relates very closely with Zimbabwe as well. Okay, so hopefully everyone will be there. I think we have a class size of close to 23 or 24. Even today, almost half of the class is not present. So hopefully next time. Okay, thank you for the feedback. We take our feedback very seriously. You must have seen even on the platform, the various places where we ask you for your feedback, and then at the end there is a longer feedback as well. So please keep giving us feedbacks, any issues that you face. There is a WhatsApp group. You can either email us. So you can email us on this. You can directly email Priyanka, or you can also write in the comments or any forum on the course. So whichever way you do it, we will reach out to you and we will try to address any issues that you may face. Okay. So if there are no other questions, no other clarifications, then I would like to thank all of you for listening to me for 2 hours. I know it's not very easy. And I wish you the best for today and for the upcoming weekend. I keep following your responses on the platform, and I will start to respond back to some of you as well. I've been waiting for a good number of people to start looking at the discussion. And then I will ask you follow-up questions over there. And then hopefully next week we all meet again, and then we'll go over strategic procurement. So with that, thank you so much. Have a great day, and we'll see you next week. Bye-bye.
Thank you so much. Have a good weekend.
Thanks.